This is a short lecture on the wrist and hand nerves and muscles, and particularly when we're talking about the nervous system, we'll be talking about their association with the brachial plexus. The first one that we're going to point out is going to be the median nerve. The median nerve actually bifurcates or splits, so I'll draw the split here. This splitting is going to bring into two different chords. It's going to bring in the medial chord, and it's also going to bring in the lateral chord. So we'll just keep tracking this through. They're both part of the anterior division. So we see as it continues to travel up the anterior division. And it's going to bring in the nerves C6 all the way down through T1. And when we're talking about these nerves, the anterior rami or the spinal nerves of C6 through T1. The next nerve that we'll look at and the muscles that are associated with that is going to be the ulnar nerve. So here, again, I'll draw the line as we go up the ulnar nerve. It's formed from the medial cord, and then it's also part of the anterior division, and it's just going to bring in the anterior rami or the spinal nerves from C8 to T1. And then finally the radial nerve over here. The radial nerve is associated with the posterior cord, and this one is actually associated with the posterior division, and will travel all the way up into the anterior rami of C5, but it also brings in the anterior rami of everything from C5 down to T1. So the first one we'll look at is the median nerve, and particularly what we're going to be looking at are the muscles that are associated with the median nerve intervention. So the first one that the median nerve is associated with the wrist and the hand is going to be the flexor carpi radialis. So any flexor muscles are going to be, their origin is going to be on the medial side or the medial epicondyle of the humerus, and its insertion is going to be at the base of the second and third metacarpal on the anterior surface or the palmar side. So its prime job is to do flexion of the wrist, but it also can do abduction, and abduction again is associated with abduction is associated with radial deviation. It is a weak flexor of the elbow, and it's also a weak pronation of the forearm. The next one with the median nerve is the palmaris longus. Palmaris longus is part of the carpal tunnel. It's also the tendon of palmaris longus is what gets used for an ulnar collateral surgery. And an ulnar collateral surgery is also named a Tommy John surgery. So again, since it is a flexor of the wrist, we're going to see the origin on the medial side. And then insertion is actually on the second through fifth palmar aponeurosis. And its job is flexion of the wrist, but it does a little bit of weak flexion of the elbow. And finally, with the median nerve, we're going to be looking at the flexor digitorum superficialis, and this is going to be the first one that has a dual job. So it does flex the wrist, and since it flexes the wrist, we know that the origin is on the medial side, and the insertion is going to terminate here at the second through fifth interphalangeal joint. So this is where we see that its other job is to do flexion of the fingers, particularly at the proximal interphalangeal joint. So the next muscles that we'll be looking at are associated with the ulnar nerve. Again, it's from the C8 to T1 anterior rami. It is part of the anterior division, and then as we go down, it's going to trigger or have motor control on the flexor digitorum profundus of the fourth and fifth fingers and the flexor carpi ulnaris. This one is also called the funny bone. This is where ulnar nerve contusions or when you hit the medial aspect. This ulnar nerve is also associated with ulnar collateral sprains. And when we saw in previous lectures of the 20 degrees of flexion and the ability of laxity to occur with abduction of the elbow, we see sometimes this nerve gets strained. Again, it's located on the medial surface of the elbow. So the muscles that are associated with this one, it is a weak flexor of the wrist. So again, we're going to see the origin going to be on the ulnar side. This one goes a little bit further, so the insertion is going to be along the distal phalangeal joint. This is what allows for flexing the tip of the finger. And then the other one associated with the ulnar nerve is going to be the flexor carpi ulnaris. And this one, again, since we're looking at flexion of the wrist, is going to be associated with the origins on the medial side. And then the insertion is on the pisiform hamate and the base of the fifth metacarpal. So it's also going to cause adduction, or what we consider to be ulnar deviation. And finally, the last one is going to be the radial nerves. I just picked out a couple of examples. There's many. A lot of these are going to be part of the intrinsic muscles, but looking at the extrinsic muscles, what we see is their job is for the extensors. So extension of the wrist, abduction, or radial deviation, and also a weak flexor of the elbow. So since they are extenders, we see that the origin changes from the medial side to the lateral side, and then this time we're going to see it inserting on the base of the third metacarpal. And then extensor radialis longus, again, it's an extensor, so it's on the lateral side. And its job is for extension of the wrist. It inserts on the dorsal surface, or the back of the hand, or the dorsal surface of the second metacarpal. It does abduction or radial deviation. It's a weak flexor of the elbow, and it also does weak pronation. So that's just a small lecture of the brachial plexus and the associated muscles of the wrist and the hand.